Good afternoon, everyone. My name is Dr. Surbhi. I'm junior resident in the Department of Psychiatry, and I will be presenting my seminar on the topic of telepsychiatry in India. We will be covering this topic under these broad headings: introduction about telepsychiatry, what is SCARF, trends in India, telemanis, regulatory landscape, COVID pandemic, operational guidelines, modes of communication, benefits and challenges, success stories over the years, and future of telepsychiatry, followed by summarizing the whole seminar and references. What is telepsychiatry? It is basically the delivery of psychiatric assessment, diagnosis, and care through telecommunication technology, video conferencing, phone, chat, etc. A branch of telemedicine leveraging ICT for remote medical care. Why telepsychiatry? It helps us in addressing the global mental health burden, in bridging the geographical barriers and improving access to care, increases the convenience and flexibility for patients and providers, and reduces the stigma associated with seeking mental health services. SCARF. Telepsychiatry in India Services started by SCARF. It's basically a schizophrenia research foundation, and it started off with the SCARF telepsychiatry in Pudukkottai in Tamil Nadu. SCARF is basically an NGO which is providing quality care and rehabilitation services in the fields of mental health since 1989. Introduced the first and only mobile telepsychiatry service in India, widely accepted and endorsed by the rural population in the remote villages. Trends in India. Government of India has implemented telemedicine through e-Sanjeevani in the Ayushman Bharat Health and Wellness Centers, advocating the use of digital tools for improving the efficacy and outcome of healthcare system. Mental health assistance and networking across the states, which is Telemanis, was announced in the Union Budget of 2022. A little bit about Telemanis. Telemanis, it's a program which was launched on 10th of October 2022 on World Mental Health Day by the Ministry of Health and Family Welfare. Its aim is to provide free 24/7 telemental health services all over the country. And functions are to provide mental health counseling services through Telemanis cells, establishing linkage with physical in-person consultations for those who need in the district through district mental health program, e-Sanjeevani video consultations, and also mentoring institutes, which are mental health institutes or medical colleges. So it basically links the whole mental health infrastructure together so that it can be dispersed and dispensed to the rural and the most remote population as well. Regulatory landscape. Global context. Many countries developed guidelines, example World Psychiatric Association, Telepsychiatry Global Guidelines 2020. Emphasis on cultural fit, confidentiality, security, and ongoing evaluation. Challenges in reimbursement, legal or regulatory, licensure, and credentialing across states and countries. India's regulatory framework, Telemedicine Practice Guidelines 2020, which formalized telemedicine in India, Telepsychiatry Operational Guidelines 2020, which were released by the Indian Psychiatric Society, Telemedicine Society of India, and NIMHANS in the year of 2020. Alignment with existing laws, Information Technology Act 2000, Mental Healthcare Act 2017, etc. Prescription rules categorizing the medicines list O, A, B, C with specific requirements for initial versus follow-up consultations. Mandatory online course. RMPs intending to provide online consultation need to complete a mandatory online course within 3 years of notification. Impact of COVID-19 pandemic. It basically accelerated the adoption. Pandemic necessitated rapid shift to remote mental health services globally. India's response was that Government of India published telepsychiatry guidelines on March 25, 2020. e-Sanjeevani outdoor platform launched on April of 13, 2020. spurt in teleconsultation, 30% increase, and telepsychiatry utilization, up to 50% spike in over 50s in India during the pandemic. Ensured continuity of mental health care during lockdowns and travel restrictions. Lessons which were learned were that it highlighted the potential of telepsychiatry as a game changer. Need for standardized training protocols and certification courses for telepsychiatry. Importance of hybrid models like face to face and teleconsultations. Addressing the burden on mental health professionals. Telepsychiatry Operational Guidelines 2020 enhanced. So basically, it is a guideline module which comprises of various headings and some consent annexures. So the first heading which it deals with is legality. Telemedicine practice guidelines have been included as an amendment to the Indian Medical Council Professional Conduct, Etiquette and Ethics Regulation 2002. Psychiatrists must adhere to laws like the Mental Health Care Act and Information Technology Act 2000 while practicing telepsychiatry. Medical legal issues such as verifying patient's identity, ensuring patient presence, obtaining consent, and advising in-person consultations for emergencies are addressed. It is a very important point which has to be mentioned that whenever emergencies are being addressed, any doctor who's practicing telepsychiatry has to make sure that the person has to be seen in person and not through telepsychiatric consultations. Second is advertisement of telepsychiatry practice online or social media. Soliciting patients directly or indirectly is considered unethical according to the Indian Medical Council Regulation 2002. Caution is advised against using online telemedicine platforms that advertise doctors' photos, patient ratings, or make patient-doctor responses public. Sorry. Psychiatrists are encouraged to offer telepsychiatry services to their own patients and maintain professional boundaries on social media. It is mentioned in the module itself that if a psychiatrist has to somehow uh, make their presence felt on the social media, so they need to have two different profiles, one for their personal use, the other one for their professional use. Technology of telepsychiatry. Essential technology includes a dedicated phone line, email ID, good internet connectivity, a laptop with a camera, and a printer. It is mentioned in the guidelines also that no elaborate setup is required. A simple working functional setup will do the job. The guidelines suggest choosing telemedicine software that is simple to use and accessible for patients, including social media, video conferencing applications if patients are comfortable. Most preferred one is Zoom, Google Meet, etc. Recommendations for telepsychiatry chambers include proximity to the in-person OPD, good lighting, preferably natural or LED white light, and a clutter-free light blue matte background. Then talking about the most important aspect, which is electronic health record or electronic medical records. Psychiatrists can choose a telemedicine platform integrated with an EHR or use a standalone solution, ensuring compliance with the Mental Health Care Act 2017. Sorry, sir. Explicit consent is required before recording audio or video of telepsychiatry consultation, and devices should be secured to prevent unauthorized access. And the access should be only and only present with the psychiatrist's consent. Psychiatrists can provide telemedicine consultation to patients from any part of the country, but must consider state-specific regulation registration requirements, as health is a state affair in India. So it is important to comply by different state rules. Stepwise operational guidelines for telepsychiatry consultation. So it is divided into three categories as per the guidelines also. So before consultation, it is important that psychiatrists should review the patient detail, medical records, and discuss recording intentions, ensuring explicit consent for audio and video recording. It is important to take it for both audio as well as video. During consultation, patient's identity and location should be verified, adhering to laws in patient's jurisdiction, and referral for inpatient consultations should be considered for emergencies. And inpatient consultations can also be referred if some medical, legal, or forensic psychiatry aspect is concerned. After consultation, feedback should be requested from the patients, and telepsychiatry setups should prioritize technology that works best for the patient. Initiation of telepsychiatry consultation by a family member or a healthcare worker. So basically, telepsychiatry consultations, they can be initiated by the family members with explicit consent from the patient, adhering to the Mental Health Care Act. In-person consults should be advised for the first-time consults with children or incaptivated adults, and consent from the family members or nominated representatives should be documented. Telepsychiatry consultations can occur between the healthcare workers and a psychiatrist, adhering to collaborative steps and obtaining patient consent. So, in this, another thing which is important is whenever some medical legal thing is concerned, so first time it always has to be a one-on-one consult. If children are concerned, again, it has to be a one-on-one consult. If any psychiatric emergencies like suicide or any delirious state or anything else is concerned, then also one-on-one consultation is recommended. Prescribing medications online and psychiatry. Prescribing medications online is at the psychiatrist's professional discretion and entails the same accountability as in person consults, requiring adequate patient information and diagnosis. It is very crucial that at least a provisional diagnosis has to be mentioned before prescribing a drug. Medications are categorized into list O, which is over the counter drug, for which it can be given in the first visit, in the first teleconsult itself. List A, which is relatively safe with low abuse potential, which are preferably not given in the first consult. And list B, which are only and only given on follow-ups. In the first visit, list B drugs are never given as a teleconsult. And list C are they're exclusively prohibited from the teleconsult. Online prescriptions must follow Indian Medical Council guidelines using generic names and require explicit patient consent before transmitting to the pharmacy. Mode of consultation and medication category. The ability to prescribe depends upon the type of consultation, initial or follow-up. Mode can be a text, audio, video, and the medication category like list O, A, B, C. The category specify which drug can be prescribed remotely. List O includes over-the-counter, while C it contains prohibited drugs that cannot be prescribed online. List O drugs. These are the over-the-counter drugs that do not require a prescription and can be dispensed by the pharmacists without formal prescribing. So, prohibition of certain drugs. The guidelines prohibits prescribing list C drugs, Schedule X narcotics, psychotropics like benzodiazepines, ketamine, morphine, tramadol during teleconsultations due to legal, safety, and ethical concerns. Prescription format and transmission. Prescriptions must be written clearly, ideally using generic names, and transmitted securely via email, scanned copies, digital signatures, or e-prescriptions. Explicit consent from the patient is required before transmitting prescription or medicines directly to pharmacies or for dispensing purposes. Teletherapy, telepsychotherapy, and telecounseling. A psychiatrist can provide teletherapy to patients from any part of the country, maintaining ethical standards and professional accountability. A detailed in-person assessment is required before initiating teletherapy, and providing the teletherapy without an appropriate diagnosis needs to be avoided. Telepsychiatry consultations and/or teletherapy should be treated the same way as in-person consultations from a fee perspective. This was the enhanced guidelines. So then there is a PGI Chandigarh model as well, which is quite similar. So since its inception about 4 years back, the PGI telepsychiatric model has expanded its reach to various remote locations, including Leh Ladakh as well, through platforms like eSanjeevani. This initiative has significantly reduced the need for patients to travel long distances, thereby saving time and costs associated with transportation. The model's success has garnered attention from the Ministry of Health and Family Welfare, which plans to extend similar telemedicine services to all AIIMS and PGI institutes across India, aiming to alleviate the burden on hospitals and improving the patient care efficiency. Ganyari model. The Ganyari model of telepsychiatry is a community-driven initiative which was launched in the April of 2012 by the Jan Swasthya Sayog, which is JSS, a non-governmental organization based in Ganyari, Chhattisgarh. This model aims to provide mental health care to undeserved tribal and rural populations in Bilaspur and surrounding areas. Now, what are the modes of communication that are used in telepsychiatry? First is video conferencing, which is synchronous communication. It is a real-time face-to-face interaction via secure video platforms. Psychiatrist evaluations, therapy sessions are conducted, and medication management is also done. Platforms which can be used are Zoom for Healthcare, Doxy.me, VC, or Microsoft Teams. And pros are that closely simulates in-person interaction, allows observation of non-verbal cues. So it becomes difficult for us to perform the MSc completely because somehow, because of some technical issues or internet issues, you might leave on some non-verbal cues as well. Challenges are it requires good internet, privacy concerns if not conducted in secure settings. Second one can be a telephone communication, which is voice only calls for psychiatric care when video is not available. Follow-up consultations can be done through this. Medication check-ins can also be done, and if some crisis intervention is to be made, if some patient is having some suicidal ideations or something, at that time telecommunication comes very handy. So it is accessible, it is useful for patients without internet or video capability. But challenges are because of lack of visual cues, limited in accessing affected body language. Text messaging and chat-based communication, which is also known as asynchronous or synchronous, which can be both ways. So it is use of secure messaging apps to support a brief consultations. Use is that appointment reminders can be given through it, follow-ups can be given through it, and even behavioral check-ins can be made time to time. Pros are that convenient and low bandwidth and can provide ongoing support. Though challenges are, there is always a risk of miscommunication may also lack clinical depth. E-communication, which is asynchronous, so it is not a real-time messages used for communication or documentation. So it helps us in sending resources, summaries of the sessions, prescriptions or referrals. It is well documented and structured and can be reviewed later. Challenges are they're not ideal for urgent care and can require encryption for privacy. Patient portals and electronic health record communication. They are secure platforms for sharing information between patient and the provider. So you can use sharing lab results, sending messages, reviewing treatment plans. Pros are that they're centralized and secure and useful to care coordination. Challenges again, there is limited interactivity and which is very less personal. Group teletherapy sessions, they are video-based group therapy or support sessions, support groups. So here we can provide peer support. We can do some, we can share some experiences together. Therapeutic discussions can be done. It gives a very community feeling and it is quite cost effective as well. Challenges are obviously confidentiality and group management online. Now, in the past, since the COVID years, this is how India has been affected. So there is a vast population and geographic diversity, significant healthcare challenges, particularly in remote areas. Urban-rural divide is quite significant in our country. About 70% of the healthcare infrastructure is in urban areas. And doctor to patient ratio is also quite detrimental. So it is 1 is to 1500, which is lower than the WHO recommended, which is 1 is to 1000. Even more skewed in the rural areas, which becomes almost 1 is to 2500. Healthcare spending about 2.1% of the GDP, significantly below global average, high out of pocket expenses. So here is what the telepsychiatry brings a lot of benefits. So there is increased accessibility, overcoming geographical barriers, especially to rural and undeserved populations. Convenience and flexibility, there's reduced travel time, waiting time, and cost for patients. There's reduced stigma, which is quite significant with our illnesses. It offers privacy, anonymity, and encouraging more people to seek help. Continuity of care, especially for patients who travel frequently or have unpredictable schedules. Cost effective, saving on travel for patients, reduced overhead for providers. Enhanced patient engagement, higher adherence to treatment plan, and safety and comfort, receiving care from home, minimizing the exposure risk, which is relevant during the pandemics, especially. National programs like eSanjeevani, which is India's national telemedicine program, enabling millions of consultations. Now, what are the challenges that we have to face with the telepsychiatry, which makes us work more into this field? First is the digital divide. Limited digital literacy is there, especially among the older adults in the rural population. So, limited smartphone access and unreliable internet connectivity becomes another important issue. Socio-cultural factors, preferences for in-person consultation. A lot of people still want in-person consultations, especially our patients. Trust in digital care and data privacy concerns. Provider level challenges, lack of training for mental health professionals in telepsychiatry, concerns about quality of care and medical legal aspects, outdated hospital information systems and documentation burden, difficulty in establishing rapport and detecting non-verbal cues remotely. System level challenges, integrating telemedicine into existing infrastructure, ensuring data security and privacy, inadequate funding and resistance to change. Standardized protocols and clear regulatory framework are still evolving. Reimbursement of financial issues for clinicians. Success stories. Nagpur Municipal Corporation Telemedicine Initiative provided free expert medical consultations to over 1,800 patients in 3 months, benefiting economically disadvantaged family. Impact, which is improving access through telepsychiatry program in Goa, demonstrated acceptability and feasibility of assisted telepsychiatry in routine healthcare services settings. Various institutions maintained continuum of care during the COVID-19, like NIMHANS, AIMS, New Delhi. Future of telepsychiatry. AI integration, AI-powered diagnostics, remote patient monitoring system, personalized treatment plans, expanding service range beyond consultations to include physiotherapy, nutritional guidance, etc. Technological advancement, widespread availability of 5G, improved digital infrastructure, AI chatbots. Policy prioritization, telehealth becoming a foundation of universal access, not just a convenience. Digital health IDs and interoperable medical health histories, Ayushman Bharat Digital Mission, addressing challenges, targeted investment, inclusive design, ongoing research, and public awareness campaigns are crucial for substantial and effective use. In the end, I would like to summarize by saying that telepsychiatry is transforming mental health care delivery, offering a significant benefit in accessibility, convenience, and reducing stigma. While challenges remain, particularly in the low and the middle income countries like India, the rapid adoption driven by the pandemic and evolving regulatory framework indicates a promising future. Continued focus on the infrastructure development, digital literacy, training, and robust ethical and legal frameworks will be essential for realizing the full potential of telepsychiatry globally and in India. These are my references. Thank you.